Protection of Healthcare Workers During COVID-19, Mesenchymal Law, Infectious Disease and Critical Care Medicine, March 25, 2020. In the Chinese study, 3.5% of patients were healthcare workers, physicians, nurses, and other therapists. In the Italian study, 8.9% of patients were healthcare workers. It is imperative that we protect ourselves so we can continue caring for our patients. The CDC has clear guidelines on how to minimize the risk of healthcare personnel exposure to COVID-19. They put that in 3 categories. The first one is how to limit entrance of the virus into the facility, for example, providing telehealth for those patients and minimization of all non-essential operations in the hospital. And then we need to isolate those patients as soon as possible when they come to the facilities, such as providing triage point outside the ER, and the nurse taking care of those patients would be wearing appropriate protective equipment. Once those patients are admitted into the hospital, healthcare personnel should follow clear guidance on how to protect themselves, whether it is droplet versus airborne precautions. The virus is transmitted through droplets mainly in contact with our mucous membranes. Those droplets are generated by the patient, and usually they drop within 3 feet. So if we get closer to the patient, more than or less than 3 feet, at that time we need to have droplet precautions. Those droplets are of more than 10 micron in size. That's why they drop very shortly after they are generated. However, in certain situations and procedures, these droplets can become what we call infectious droplet nuclei, and they are airborne. At that time, healthcare workers should follow airborne precautions. Those airborne nuclei are generated in what we call aerosol generating procedures only in special situations. These procedures can be endotracheal intubation, manual ventilation with the ambu bag prior to intubation. That's why we created a clear procedure and guidelines for this special procedure, so we can minimize the risk of exposure to healthcare workers. Other procedures include non-invasive mechanical ventilation. That's why we need to avoid those procedures as much as possible, and if they need to be done, they have to be done in a negative pressure room. Any respiratory and airway suctioning, including tracheostomy care and sputum induction, is included in these procedures. Medication nebulization with the bronchodilators, those are procedures known to generate aerosols, and they need to be avoided. We are replacing the bronchodilators by nebulization with the MDIs. However, you need to make sure that you have the appropriate and right indications before using MDIs, because supplies are limited. Nasogastric aspiration could be one of those aerosol generating procedures too. Other procedures include bronchoscopies, tracheostomies, and any mechanical ventilation with active exhalation, such as high frequency ventilation, of course CPR, and autopsy procedure can generate aerosols. Those procedures should be done in negative pressure rooms when available. So the precautions for droplet would include the surgical mask, in addition to water-resistant gown and gloves. If available, you can put goggles too. However, in those special procedures that generate aerosols, airborne precautions should be the ones that we are following, and the surgical mask is replaced by an N95 or higher protective mask, and we should put also goggles. This will show you the differences between those masks. For the surgical mask, it is efficient for droplets and it is not efficient for aerosols. For N95, it is efficient for droplets and 95% efficiency for aerosols. The powered air purifying respirators are more efficient in terms of the aerosols in 99.97%. The N95 should be fitted through a fit test that should apply to all healthcare personnel before they start working with those patients. Similarly, the PAPRs the person should be trained before using the PAPR to make sure that the application is according to the instructions. So the use of face masks for all patients and anyone who is in close contact with those patients. N95 is only for aerosol regenerating procedures that are mentioned in the previous two slides. And PAPRs would be used whenever available in aerosol generating procedures. This is the CDC page that has all these recommendations. So I would encourage everyone to visit this page and review these instructions very well so we can protect ourselves in the best way. Thank you very much.